Diabetes is projected to double from 24 million to over 44 million people within 25 years. Physicians, the healthcare community, policymakers, and patients will now have a resource that will define diabetes and the trends that are shaping the U.S. diabetes market. Experts on diabetes care were asked to discuss the value of the U.S. Diabetes Index, an internet-based tool that will provide users access to more than 30,000 tables, charts, graphs, and reports.
I think the most unique aspect of this is that it actually gives us facts where we've had to really depend on suspicions in the past. But now I think it's actually possible to look at a map and see what the zip codes are that define and contain the most intense concentration of diabetes-related problems and populations. Now I think you have the tools that can mobilize communities to an I can kind of posture. And when you can actually motivate communities, activate communities to own their problem and to commit to doing something about it, and I think that the index is really a tool that can help consolidate those kinds of forces, I think that's a game changer.
I think that this map and this sequence of maps and this website will allow us to look at it and its impact on different population, different ages, different states, different cities. So I kind of like to use the analogy that you can actually look up in kind of real time what the score is. But I think by looking at this website, we can see how we're approaching all of patients at a broader level, so therefore you can kind of get a satellite view of things.
We ask our diabetes experts to comment on how the U.S. Diabetes Index will impact their assessment of diabetes where they practice.
The Diabetes Index will be useful for every physician. For example, if I work in Dallas, Texas, and I want to know how Dallas is doing compared with other places, the information that we can gather from the U.S. Diabetes Index will be very important to me personally, but it will be very important for every physician or any healthcare group that has to deal with diabetes, because it will tell me, am I doing a good job? You know, am I better than other states or other zip codes? You know, what can I do to improve? I think it will be terrific for every one of us to know how we're doing.
On the practice level, it allows them to understand the populations that they're dealing with and tailor the services that they're providing, make sure their education programs are designed best for the people that they're working with, and also help them understand where areas are that are underserved. So that is, it's got to be applauded. It's just so exciting. And having that data and information so readily available, it's going to help the research projects be tailored to answer the research questions that have to do with issues around prevalence and gaps. So I think it's just fantastic.
Let's take a closer look at the U.S. Diabetes Index.
This tool not only helps you understand how people are living with diabetes, but it also gets us to the point where we understand what does the future look like? What are the trend lines looking like in these communities? And where do we need to put in preventative services to reduce the number of people living with the disease and to slow up the progression from pre-diabetes to diabetes?